thank you again for your love and your mercies toward us. And as we go over the different lab tests, the different lab values, we ask for you to give us wisdom, insight, and to work out your will and way. We pray in Jesus' name. Amen. All right, if you would like to, if you have your own blood work with you, you can jot down notes and that kind of stuff, even on your blood work or by your blood work. If you have abnormal numbers and that kind of stuff, you're curious about what those they mean, I'm going to go over all of that stuff while we're going through. Up on the screen, we have an example of somebody's blood work. I've taken off, I hope, all identifying information from that, so that you don't know who it is, and in fact I don't think it's anybody that's in this seminar. This is the setup, how your lab is going to look. It's from the AccuReference Medical Lab, and you'll notice that it should have your name up here, and then your date of birth, your age, your sex, and that kind of stuff. It has our information below that and yours. And then you'll notice that the first section of the lab work has this first section called out of range summary. Right now we're going to ignore that. All that is everything in the blood work that is considered to be abnormal as far as the lab standards are concerned. But we're going to be talking about each and every one of those things down below. So don't get stuck in that area. We're going to just go right down to it, to the section below it called hematology. And we're going to start with the CBC, which stands for a complete blood count. All right? So this section is looking at all of the different cells that are in the blood. Right? The different cells that are in the blood, and their different levels and sizes and so on and so forth. That's what we're going to be looking at here. And the first one that you'll see is WBC. All right, so WBCs are your white blood cells. These are the ones that are responsible for fighting infection and so on and so forth. And you may think that it's a good idea to have a whole bunch of them around in your circulation. It's not. Because if there's a whole bunch of them, sometimes they create trouble. In and of themselves, like the immune system has a response to kill them after a certain period of time. And they're supposed to die off after an infectious process or whatever, because if they don't, sometimes they turn into little rogue white blood cells and then they start creating damage where they weren't supposed to. You'll notice that the lab says that the reference goes from somewhere around 4.2 to 11.8. Some of these reference numbers will be different on yours than up here on the screen, because some of them depend on your age and your sex as to what they consider the reference range to be. And let me just state this up front. How do we come to these numbers? Most of the numbers in the lab work, where it says that it's this is the normal range or this is the reference range, most of those numbers have come up by simply taking a bunch of people from the population that are considered to be healthy and testing those levels, getting an average, and then in statistics you know that most people are around a center point. And then farther from that center point, you get fewer and fewer people. And so you get this thing called a bell curve. Right? So you have a bunch of people around the center point, and then fewer and fewer and fewer, and then it kind of tails out on the end. It looks kind of like a bell. And what they do is they take those hundreds or thousands of people that they got the test from, they're testing the one particular thing, and they say, okay, we're going to take, let's say, 95% of people. We're going to cut 2.5% off of this side, 2.5% off of that side. Everything in there is considered normal. Anything that's above that is considered abnormal. Anything that's below that is considered abnormal. Now, if you take a population of several hundred or a few thousand people, and they're not healthy the same way you're healthy, you may not fit within their range, right? And if they choose the cutoffs at 95%, well, you're normally going to have 5% that's going to be outside of the range that still may be considered healthy. If they choose 98%, then you've got 1% you cut off on one side, 1% that you cut off on the other side. So it's not cut and dry. So we'll be talking about some of the differences from that standpoint. So white blood cells, the lab will show you that 4.2 to 11.8 is normal, not for an individual on a plant-based diet. Right? Individuals on a plant-based diet have lower white blood cell counts. And they tend to have white blood cell counts in the range of 3 to 7. So that range, what we're looking for in individuals for white blood cell count is somewhere between the range of 3 and 7. If you're above that, it may be because you've been eating meats, right? Been eating flesh foods, that will cause those numbers to go up. It may be because you have an infection, right? And if the numbers are really high, really high, then it could be related to a cancer of the white blood cells, right? Called leukemia. Leuc means white, emia in the blood, so it's a too high number of white blood cells, an overproduction because of a cancer standpoint. If your number is lower than that, I usually tolerate anywhere from about 2.5 and up and say, okay, well, it's probably not much of a problem. If you're getting lower than 2.5, then there may be a concern for something going on causing the white blood cell counts to be too low. Right? And you can have a viral infection. Right? So viral infections can drive the white blood counts down. That's probably the most common thing that does. You may have issues with like an iron deficiency anemia, and you could have a process that's impacting the bone marrow. So you might have drugs that are suppressing the bone marrow's function, or you could have a cancer that's in the bone marrow that's taking up the space that the white blood cells would normally be developing in. Some of those are reasons why you would have too low white blood cell counts. Now the next number below that is RBCs, or red blood cells. These are the main ones that make up the blood. And you'll notice that the lab says 3.8 to 5.0. At least that's, again, men, your reference is going to be different here. This one's for, I think this was a 61-year-old female. So it says 3.8 to 5. Men, your reference range is going to be actually higher than that. And if you're on if that red blood cell count is low, the most common reason is because of iron deficiency. Right? And typically in females because of monthly cycles. And so iron deficiency is the most common cause for that to be low. You can also have chronic infection or chronic illness that can cause those numbers to be low. You can have genetic disorders like thalassemia and sickle cell disease that can cause those numbers to be low. If it's high, then you have an overproduction of red blood cells. That would be hemochromatosis, and you're an overproducer. Maybe you have high iron levels, and the body's got to put it somewhere. That may be a reason for that. Or you're a meat eater, and the body incorporates a lot of the heme iron from the blood that's in the meat that you consume. All right, that can lead to that. We actually prefer individuals to be on the lower end of normal or even a little bit below normal as far as the RBCs are concerned, the red blood cells. Because when it's too high, when it's on the upper end of normal or high, then those red blood cells, when they get to the capillaries, they've got to bend themselves and squish through because the capillaries are smaller than red blood cells. And so they have to squish and go through, and if you have too many red blood cells, then you get kind of a traffic jam there. And you start developing microvascular damage over time. Hemoglobin, it's the next one below that. That's listed in, yes?
So what would the plant-based average be
A plant-based average for red blood cells, well, it depends on if you're a woman or if you're a man. Whatever your reference range is there, if you're in the middle range to, I would say maybe a 0.5 or so below what the lower end is considered, it would be good. The hemoglobin, this is the oxygen carrying stuff on the inside of the red blood cells. It's a protein iron complex, and the hemoglobin, that one is what individuals look at or doctors look at to tell whether or not you're anemic or not. So if this number is low, you're considered to have anemia. If the number is normal, you're fine. If it's high, then you have hemochromatosis. And that number being low, all right, again, just like the red blood cells, we like to see it. I like to see the hemoglobin level somewhere in the 11, 12, 13 range. 11, 12, 13 range. If you're a man, 14s are okay, but I wouldn't want to go above that. If you're above that, then again, you're getting the traffic jam and that kind of stuff happening in the blood vessels. What do you do about it? Donate blood. Yeah. If the numbers are too high, just go donate blood on a periodic basis. Yeah, donate. Yeah, donate blood. No, that's right, donate blood. Yeah, that's another one, right? But donate blood as well. That helps. Yes. Yes. HGB is hemoglobin. That's the. You want to, for men, you want to keep in the 11, 12, 13. You can handle 14s, okay, but you don't want to get up to the 15, 16, 17 range so much. And then if you're below that, again, iron deficiency, most common cause. Same things for the red blood cells. Iron deficiency, chronic disease, genetic issues, inherited issues like thalassemias and that kind of stuff. Hematocrit, just below that, HCT, sometimes it's abbreviated as HCT. Hematocrit is just a different way of looking at the same thing as hemoglobin. Hemoglobin is looking at grams per deciliter. Hematocrit is the percent. So when they get your blood and they take it and put it in a tube, and then they spin it in a centrifuge, it separates. The heavier stuff, like the red blood cells, goes down to the bottom. The white blood cells aren't quite as heavy, so they layer on top of that. And then the serum is pretty light, and so it layers off on top of that. And so that column gets separated out. You get the yellow serum, you get the little tiny white blood cell layer, and then you have the red blood cells below it. The hematocrit is the percent of that entire column that's made up of the red blood cells. And it usually goes right along with the hemoglobin, so I don't pay a whole bunch of attention to it because the two are basically talking about the same thing. All right, below that is your MCV. That's your mean corpuscular volume. That's telling you the average size of your red blood cells. And I usually like to stick with the lab's ranges there as far as the size is concerned. And the MCV tells you basically whether or not you have enough hemoglobin that's filling up the red blood cells. If that number is low, if your MCV is low, most frequently that's because of iron deficiency. Again, you don't have enough iron to produce the hemoglobin molecules. There's not enough hemoglobin to fill the red blood cells. The red blood cells tend to be small. Thalassemias, again, a genetic inherited disorder can do that. Chronic illnesses can do it as well. If it's too big, the MCV is big, that's typically associated with a B vitamin deficiency. Thiamine and folate are the two B vitamins that are most commonly associated with that. Sometimes you see it with alcoholics because they tend to take in a lot of calories with alcohol without having the nutrients, the B vitamins, and it can be large from that standpoint. But it can also be, it can also be large with some bone marrow or blood cancers. That might be a thing that causes it to be large as well. Just something to keep an eye on for there. Below it, the next two, the MCH and the MCH, mean corpuscular hemoglobin and mean corpuscular hemoglobin content. This is just like the hemoglobin and hematocrit, but it's looking at things from an individual red blood cell standpoint rather than all of your blood standpoint. Right? If those numbers are off, typically low, if they're off and the MCV is normal, I don't pay attention to it because it doesn't tell me much of anything. Right? What they are is basically the average amount of hemoglobin that's in a single red blood cell. That's really what they're looking at. And so if they're low on their own and your MCV is normal, then it doesn't really tell me much. I usually skim over those. If it's abnormal, I just tell you don't worry about it, because it's there. Below that, RDW, red cell distribution width. This is the difference in the sizes of the red blood cells. There are different sizes of red blood cells. The young ones tend to be bigger. Right? So when it's put out from the bone marrow, it tends to be bigger, and as it matures, it shrinks in size a little bit. That RDW, if the number is higher, so if your number is high, that means that you've got more difference in the sizes of the red blood cells. So some more of them are going to be big, some more of them are going to be small, and there's a bigger difference between them. Typically, again, that happens with iron deficiency anemia. That's the most common reason that we see that number to be high. So I haven't met someone yet that had a low MCV, RDW that I can recall. So it's usually high or normal, and if it's high, again, it can be iron deficiency anemia. Again, you can have problems with bone marrow issues. If there's a cancer in the bone marrow, it can be pushing out the young red blood cells early, and they might have abnormal sizes from that standpoint. You can have red blood cell cancers, white blood cell cancers, platelet cancers, other types of things like that that can push that number up. Sometimes you can have inflammatory processes as well that can cause that RDW to be elevated. Yes. Okay, the question is, other than leukemia, can you pick up other cancers from the blood? You can get yes, you can, depending on what tests that you do. From our profile here, there's a few of the different tests that may give us a clue, but don't specifically point it out, except for like leukemia. We can, one of those clues is, well, it's kind of a pattern of putting several ones together. So remind me about cancer at the end, and I'll go back and point out some of the different blood tests that may, if they go together in combination, make one more concerned about the possibility of cancer. Platelets is the next one. Platelets are the little guys that stick together and stop you from bleeding when you cut yourself. Right? Those should be within the reference range, which is around 150 to 365 or 400. Depends on the lab as to what their range is. Most commonly, individuals are in the normal range. Beyond that, individuals who have low numbers of platelets, you can have a harmless disease called, well, it can be harmless, idiopathic thrombocytopenia. Idiopathic means that we don't have a clue what causes it. It almost sounds like idiot, right? Idiopathic means we don't know what's causing it. Individuals can run with platelets in the 80s, 90s, 100, 110, or whatever, somewhere in that range. And they tend to be there most of their life, and it really doesn't create much of a problem. But you can have other conditions where the immune cells, the antibodies will be formed against the platelets, and the body will kill off the platelets, and the platelets drop really low. Or you can have situations where the platelets are not produced the way that they're supposed to, and their numbers can be pretty low. You don't have a big concern until your platelets get below 50. Below 50, then individuals are at danger for bleeding complications if they have trauma. So if they get in a car accident or something like that, it can be difficult to keep the bleeding under control in somebody that has platelets below 50. And then if it's below somewhere from 10 to 20, then individuals may be able to bleed spontaneously without trauma. Yes?
So would you recommend doing more on a high number since the maximum is like 365?
Well, that one, the platelets, no, as long as you're in the range, you're fine. And in fact, you can be below the range and still be okay. The platelets tend to fluctuate a bit from day to day. Like if we measured your platelets tomorrow, they may be 10 or 20 points off from what they are now. And if you measure it the next day, it tends to fluctuate fairly widely from day to day because you're producing them on a regular basis. Yes?
I'm comparing this with last year's and I see where the reference charts are actually changed as well. What makes them change the value?
Good question. I'm not sure. The question is, what makes the labs change their value? She's looking at last year's blood work and they have different ranges. I'm not sure exactly why one lab picks. We just switched labs a couple months ago, and this one is using 147 to 365. The last lab that we had used 150 to 400. Yeah. You had a question too. Okay, if you're taking blood thinners, will that affect the platelets? It affects the platelets' function, but it doesn't affect the number. So the number of the platelets should be within its range, regardless of whether you're taking blood thinners or not. Stop those. Yeah. So the question is whether, if you're doing surgery or something like that and you're taking garlic and ginkgo and other types of things like that, should you continue taking those right after surgery? And the answer is you probably should give it a day or so before you have surgery and stop those things, or a couple days depending on what you're taking them for, because they do increase your propensity to bleed. All right, if the platelets are high, what would cause the platelets to be high? That's one of your factors that you're looking at and going, could this be cancer? Right? If the platelet numbers are high, usually it's in response to big stress somewhere in the body. Right? Cancer could be one of the things that can push the platelets high. And it could be any number of different cancers, not just bone marrow ones. All right, individuals who have a severe or profound illness, whether they have a very active autoimmune inflammatory disease, right, that may push the platelets high. If you have individuals who have iron deficiency anemia, that can push the platelets high, right? And actually create an inflammatory response with that. All right, MPV, that's the mean platelet volume, so that's the average size of the platelets. Normally it's normal. You have a few individuals that it's a little bit high. You're still in the 12 range, somewhere between 12 and 12.9 or so. If you're still in that range, it's not a big deal. If you're getting really big, you're like 15 or 18 or something like that, then there may be some problems going on with a tumor of the cells that produce platelets. The differential, the automated differential below that, these are, almost all the numbers down below in that section are just different types of white blood cells that are involved in the different processes that you have from the immune system's function. All right, the first ones are called segmented, and you'll notice everyone has a percent and then a number after them. So the first number is what percent of all the white blood cells that it is, and then the other one is the number of them. Now, if you have a total white blood cell count that's low, some of your number ones down here will automatically be low as well, typically. If your white blood cell count is high up here, then a number of these down here will be high as well, because it's looking at the total number. And if the total number is high, then the individual numbers, some of those are going to be high as well. So I pay more attention to the percents. The segmented cells are also called neutrophils, and the neutrophils are primarily involved in bacterial infections. So if your neutrophils are high, then I'm thinking, where's the bacterial infection? That's what I'm thinking when I see a high segmented percent. If it's low, that typically goes along with a viral infection. So viral infections can cause the segmented neutrophils to go low. Bacterial infections can cause their percent to go up. Now the next one below that is lymphocytes, and lymphocytes are just the opposite. They predominantly deal with viral infections, and so if the lymphocyte number is high, I'm thinking virus, and then the lymphocyte number is low, then I'm thinking bacteria. So the two tend to go opposite to each other. Yes, the segmented percent tends to be high with bacterial infections and low with viral infections. And the lymphocyte number tends to be high with viral infections and low with bacterial infections. Now, monocytes below that, the monocytes are involved also in viral infections, so they could be elevated because of that. They may be elevated because of allergic type of issues, so individuals who have asthma and that kind of stuff, and sometimes their monocytes will be elevated, or other types of allergies as well. The eosinophils, which is below that as well, they can be involved. They are more commonly involved in allergic reactions. They can also be elevated with parasites. Individuals that have parasites that they're dealing with, the eosinophils can be elevated as well, and it can be elevated with viral infections too.
I have one question.
Yes.
On the lymphocytes, do you utilize the same range?
Yeah.
Okay, so
Yeah, the question was on the lymphocytes, do you utilize the same range? Yeah, we use the lamb's belly cutoffs for each of these we do actually. Basophils. The basophils, again, another type of white blood cell. They're not very common in the body, but these ones are associated. These are the ones that release histamine. They carry histamine in them, and they're the ones that release histamine. So if you have a histamine response, like with runny nose and itchy, watery eyes and all that kind of stuff, well, with the basophils, it's releasing the histamine in response to whatever the stimulus is, and they're what most people would take an antihistamine for. Right? So they're the ones that are releasing the histamine. And so if you have allergic type of issues, viral types of issues and that kind of stuff, or even injury, tissue injury and that kind of stuff, then the basophils can be elevated. All right, very important. The next one is your sedimentation rate. The sedimentation rate is a general marker for inflammation in the body. And that one, I ideally like to see it in the lower half of normal. Whatever it says your reference range is, some it says it's 0 to 15, others say it's 0 to 30. It just depends on your age, your sex, and so on and so forth. I like to see it in the lower half of normal, of whatever your range is listed. The sedimentation rate doesn't tell me where the inflammation's coming from. It doesn't tell me what's causing the inflammation. It just tells me that it's there. Right? And this is another one that I would be concerned about. If the pattern was right, it's another one that I would be concerned about as far as cancer is concerned. Now, it's usually not cancer that causes the sedimentation rate to be elevated. Usually it's some kind of inflammatory process. If you have any form of autoimmune inflammatory disease, this may be elevated and it may be out the roof. Right? If you have lupus, if you have rheumatoid arthritis, if you've got Sjogren's syndrome, if you've got scleroderma, if you've got any number of the different autoimmune inflammatory disorders, then that number will typically be elevated. And in fact, if you keep following that number and your treatment does well, you'll see the numbers coming down. So you can actually follow your response to the treatment by those numbers. If you have an infection somewhere, that number can be elevated. If you have an appendicitis or you have an inflammatory bowel disease or significant trauma and you've crushed your leg or other things like that, then all of these are things that can cause the sedimentation rate to be high. Below that, the reticulocyte count. Reticulocytes are the young red blood cells. Right? So you need to have a little bit of them there. If the number is too high, then that usually means that you've lost blood, and so the body is trying to replace it quickly. So whether that was from a bleeding standpoint, or whether that's because a bunch of red blood cells just got broken down, like you had a sickle cell crisis, and a bunch of red blood cells were sacrificed, or they sickled, and then they got broken down, and that kind of stuff. And now the body has to replace what's missing, and whatever, then that number will be elevated. Now we're going to go on to the next section, which is chemistry. And we're going to begin with the comprehensive metabolic panel. And we're looking at the different electrolytes that are there. You've got sodium, which is your salt level. All right? And again, 135 to 145, lab says 136 to 145, whatever. That's close to it, right? If you're down in the 133, 132 range, it's not a big deal. Right? If you're down into the 120s, it is. That means you're really low on salt. And probably what you need to be doing is actually adding a little bit more salt to your diet. If that sodium level is high, which is very rare, I hardly ever see anybody with a high salt level. If that's high, then it's typically associated with a severe dehydration.
You said high, does mean high beyond with the...
Beyond 145.
Okay.
And these numbers are pretty universal. The labs don't usually mess with these too much as far as sodium is concerned. Potassium, it's another one of the types of salts. It's one that you get a little bit more of in your sea salt. You don't have in regular table salt. And potassium is very important, and the levels are very important. So you notice that they say 3.5 to 5.1. Some labs will say up to 5.5 is normal. If that potassium level is low, most commonly that's associated with taking certain medications like diuretics. So if somebody is taking Lasix, if they're taking hydrochlorothiazide, if they're taking bumetanide or Bumex, these are different medications that will cause the kidneys to get rid of too much potassium. And so your potassium levels drop. You can also have a loss of potassium with chronic diarrhea, chronic vomiting, right? So you're losing it through the digestive tract. And let's see what else would cause. If you just were potassium deficient in your diet, which is very rare for individuals, then you can have it low. If it's too high, then that is most commonly associated with kidney disease. Right? So the kidneys are not able to get rid of the potassium like they're supposed to, and that's usually a later finding in kidney disease or kidney failure. Right? Once your potassium levels start going up in the process of kidney failure, that's usually the trigger where they say you need to get dialysis. because your potassium levels going up can kill you. Going down can kill you too. It's very important. The heart needs the potassium to be able to function. And this is the stuff that they give people for lethal injections, right? It's potassium chloride. And so too much potassium will make the heart stop. You can also have potassium, not just because the kidneys fail, but I've had a few individuals that are taken care of where they have an enlarged prostate, and they can no longer urinate, and so the bladder fills up, backs up into the kidneys. Kidneys can't filter because now there's so much pressure in them. That can cause a rapid rise in potassium levels.
Can the potassium test help you to let you know someone has prostate?
Can the potassium test help you to know if somebody has any prostate problems? Usually not, and you'll know that you have problems before the lab work would ever show it. Because you can't urinate, your bladder is completely full, you're writhing around in pain, and usually at that point that's when the lab work starts going up, but you knew it beforehand. Chloride goes right along with sodium and potassium. It's the negatively charged particle that goes with them. I usually don't pay a lot of attention to it because it usually doesn't get messed up on its own. It's usually just along for the ride with potassium and sodium. Alkaline phosphatase below that is an enzyme with the liver primarily, but also with the bone. Alkaline phosphatase tends to be elevated in individuals that have blockage to bile outflow. So if you have gallstones, right, and you get blockage to that bile outflow, then the alkaline phosphatase can be elevated. If you have liver injury or liver damage, that can cause alkaline phosphatase to be elevated. If it's the only, quotes, liver enzyme that's elevated, then it's probably not the liver. It's probably coming from somewhere else, and the next most likely place would be the bone. Right? And when I see individuals that have high sedimentation rates, that number for inflammation, and high platelet levels, which tells you that the body's severely being affected, and I see an alkaline phosphatase level that's elevated by itself, and the rest of the liver function tests are normal, then I'm really thinking of cancer that's involving the bone. Whether it's breast cancer that's gone to the bone, prostate cancer that's gone to the bone, another type of cancer that's gone to the bone. My antenna's up at that point, and I'm really concerned about that. All right, so your children, when they were young, they had elevated alkaline phosphatase levels, and you couldn't figure that out. You can have genetic problems with the enzyme, and potentially lead to elevated levels. But I'd have to read up on that some more. It's not one that I run into very often. So. Yeah, it's a liver enzyme, but it's an enzyme that's found in the bone marrow, it's found in the pancreas as well. There's a number of other organs or tissues that will produce alkaline phosphatase as well. Primarily liver, secondarily bone, and then there's a few other organs that will produce it as well. Yeah. Glucose, all right, that one's really important. This is your fasting blood sugar. We use different ranges here. We want to see those numbers in the 60s, 70s, or 80s. The 60s, 70s, or 80s. That's really where you should be as far as the fasting blood sugar is concerned. If you're running in the 90s, 105 range, then really you're in the pre-diabetes zone. And if you're running officially, you have to be 126 or above to be diabetes. But hemoglobin A1C, which we're going to be looking at later, has changed that a little bit. And you can get a diabetes diagnosis before that. So yeah, we want to see that number. If it's below that, then you've got hypoglycemia, which is usually an early process of the development of type 2 diabetes. Usually an early process in the development of type 2 diabetes, hypoglycemia. And if your numbers are higher than that, then you're looking at diabetes. All right, so that's the glucose. Below that is BUN, or blood urea nitrogen. And below that is creatinine. I'll talk about both of those. Both of those are substances that are produced as a part of metabolism or the breakdown of muscles. And both of them the kidneys get rid of. And so if their numbers go up, then that means typically that the kidneys aren't functioning as well as they should. Right? So the higher those numbers go, the lower the kidney function is considered. The lower they go tends to be the better the kidney function. Now with BUN, if it's too high, it's typically low kidney function and much of the time associated with dehydration. Right? So that's high, right? So high is usually individuals who are dehydrated and it's affecting the kidney function. Now it doesn't have to be dehydration, but most of the time it is. Just plain old kidney failure for any reason. Once it gets bad enough, those BUN levels are going to go up. Low numbers for BUN, low numbers typically are individuals who are on a low protein diet, who are fasting, and are well hydrated. Right? So if you're on a diet that's low protein, if you've been fasting, and if you're well hydrated, then that BUN level will tend to be low. Otherwise, most individuals float around in the normal range. Huh? Yeah, what's on your reference range? So usually 7 to 25. That's below the reference range. Creatinine, that's the main marker for kidney function. And it's the main marker that we look at for kidney function. It is a protein that is in the muscles and that's broken down on a regular basis and gets into the bloodstream. The kidneys have to get rid of it. So I like to see that number below 1. I like to see that number below 1. And if it's low, that's perfectly fine. That means you have even a better kidney function. So low numbers are great as far as the creatinine is concerned. But I like to see it below 1. If it's 1 or above, then I'm already thinking that you have early kidney problems. Right? Whether it's because of diabetes or high blood pressure or dehydration or whatever, right? If it's 1 or above, I'm already starting to get concerned in regards to the kidney function. And the higher it is, the worse the situation is. And diet, yes, diet affects your kidney function, but your hydration status is even greater. So maintaining a good hydration status is key for the kidneys. Yes. All right. The BUN to creatinine ratio. Basically, if that is above 20, and I see their reference range, but if that's above 20, then it means you're dehydrated. If it's below that, you're okay. But if it's above 20, then that means that you're dehydrated. The BUN to creatinine ratio. BUN/creatinine ratio. Below that is bilirubin, the total bilirubin, and that's one of the other liver function tests. Like alkaline phosphatase, it tends to be elevated if your liver can't get rid of the extra bile. So if you have gallstones and they're blocking the gallbladder, or one of the stones has gotten into the bile duct, then I would typically expect to see your bilirubin levels go up and your alkaline phosphatase levels to go up at the same time. You typically see both of those going up together. Now, if your bilirubin is high, and it's a little bit high, right? So it's a few points above what the normal range is, 0.3 to 1. So you're up at 1.2, you're up at 1.5, you're up around 2, 2.5 or something like that. And it's been that way for a long time. You can have a genetic condition called Gilbert's disease. And it's just that you don't have as much of the enzyme that's there that converts the bilirubin, and so your blood levels tend to be a bit higher. Right? Doesn't create any problems. But if it's something that's new, you haven't had it in years past, and your bilirubin levels are elevated, then it tells me there's some kind of blockage, either blockage to the bile that's being released from the liver, or you're getting excess breakdown of red blood cells in the bloodstream, like sickle cell crisis or something like that. Because the breakdown, one of the breakdown products of those red blood cells is bilirubin. And so both of those would be of concern from that standpoint. Calcium, we typically go along with the reference range there. If it's low, you just have low calcium, you need more. And maybe you have a vitamin D deficiency because vitamin D is necessary for calcium absorption. And maybe you don't have that much of it in your diet or so on and so forth. If the calcium levels are high, that's pretty rare, but it can be because of problems with the parathyroids, and parathyroid hormone and calcitonin. So an endocrine problem. Below that is your total protein. That should be within the reference range. Again, vegans tend to be a little bit lower on the scale, but still usually within the reference range. If it's low, that means that you're either not getting enough protein that stays in the blood, or you can have kidney damage where the kidneys are dumping or spilling protein in the urine, and that can drop your protein levels as well. The way that you check that is if you did a urinalysis and then check for proteins in the urine. There shouldn't be any proteins in the urine, but if you do your analysis and there's proteins in the urine, then you go, oh, all right, there's something wrong from the kidney standpoint. The albumin is the main blood protein. Again, it should be within its reference ranges there. And for vegans, it'd be a little bit lower end of normal, but still within normal. If it's low, same problems as the total protein. And it's hardly ever high. ALT and AST, the SGPT and the SGOT below that, both of those are your main liver function enzymes. And both of those tend to function together, and both of those tend to go up together and go down together. If you have a number that's low, that's perfectly fine. It's okay to have a low number. If it's within the normal range, that's fine. But if it's high, then we're thinking that there's some kind of injury or inflammation or problem as far as the liver is concerned. So you might be concerned about hepatitis, whether it's hepatitis A, B, or C, or D, or E, or G. And there's a whole bunch of them. But anyways, the most common ones are hepatitis A, B, and C. Right? You're concerned about that. You're concerned about the possibility of some other kind of infection in the liver. Like you can have parasite infections in the liver as well. You can have damage from alcohol or other toxins and that kind of stuff that can cause the liver enzyme tests to go elevated. You can have trauma. All of those can cause them to go up. And again, low is okay. Carbon dioxide, CO2, it's usually within the range, but if it's high, then you might have been holding your breath for a while in anticipation of the wonderful experience you were going to go through at the time of donating your blood. And if it was low, then you might have been hyperventilating in the expectation of that event coming on. Globulin is the antibodies, right? That's the accumulated amount of antibodies that are in the bloodstream. If it's high, then that means there's some kind of antibody-mediated response that's going on. All right? So too many antibodies that are being produced some kind of either inflammatory process, or you can have something like multiple myeloma, which is a cancer of the B cells that produce the antibodies, and you get a way overproduction of the antibodies. And if it's rarely low, but if it's low, then that means that you don't have much antibodies floating around. And you could again have an autoimmune type of disease or a cancerous disease that affects the production of antibodies. Then the globulin levels would be low in that case. And then the AG ratio is the albumin to globulin ratio. Typically, if that's low, then you're thinking about the possibility of these blood cancers, the bone marrow cancers, the multiple myeloma, if it's low. You're thinking of things like myeloma, multiple gammopathy of unknown significance, these B cell tumors. And then finally in this section you have the glomerular filtration rate. Wow, I'm in trouble. It's already 11:21 and we're not even halfway. All right, I gotta speed up. The glomerular filtration rate is just a calculation based upon your age, your sex, and the creatinine level above, which was about kidney function. So the GFR is basically a way of estimating how much fluid gets filtered through each nephron in the kidney. So that number should be, in most individuals, it should be above 90. For optimal kidney function, you're looking at above 90. If it's between 60 and 90, then you're already in stage 2 chronic renal disease. If it's between 30 and 60, then you're in stage 3. If it's between 15 and 30, you're in stage 4. And if it's below 15, then you are miraculously alive without dialysis, or you're on dialysis already. That's stage 5 chronic kidney disease. That can be changed, all right, if your number is too low. And if you are African American, 60 to 90 is stage 2. For some reason, they give stage 1 to the normal number. I don't know. Weird. Vegetarians still will fit in the pattern. Yeah. So if you're African American or black colored, then you need to take whatever number is listed there and multiply it by 1.21. So if the number, like on this one, was 76, and you get the 76 and you multiply it by 1.21, and that gives you your actual number. Right. So if you're Caucasian, then the number that's listed there is your number. If you're African American or similar coloration, then you multiply it by 1.21, and that would be your number. Above 90 is normal. Above 90, they call it stage 1 chronic kidney disease, but I don't know. That's normal. 60 to 90 is stage 2. 30 to 60 is stage 3. 15 to 30 is stage 4. And basically 15 or below is stage 5. So yeah, that's a kidney function. Below that, we're going to the lipid profile. So this is looking at your cholesterol numbers and everything, right? How are you doing from a fat standpoint? The total cholesterol, that's your first number that you come to. Ideally, we want that below 150. Ideally, you want that number below 150. And the only individuals that on average meet that goal are vegans. On average. Yeah, keeping it under that is good. And I'm not sure that there's a too low, below 150. So that's where you want to be from a cholesterol standpoint, a total cholesterol. Now triglycerides is the next number. Triglycerides are available fats for energy. This is what gets stored into fat cells It gets broken down by the liver to turn into sugars and other things like that. The triglycerides should be below 100. And that's the ideal range that you're looking for. And by the way, with all of these, what's going to mess up your cholesterol is primarily, number one, eating cholesterol. And cholesterol comes in any animal, whether it's a fish or a chicken or a cow or anything. If it can run, swim, or fly, it's got cholesterol. It's part of, or slither or whatever else. If it's got a face or a mother, it's got cholesterol. Right? It's just part of the cell membrane. Right? You and I have cholesterol. We need cholesterol. But your liver produces all the cholesterol that you need. You don't need it from a dietary standpoint. So if your cholesterol levels are higher, the easiest way of getting that number down is simply cutting the cholesterol out of the diet.
So what is the fish for the omega-3?
Well, if you eat the fish for the omega-3s, then you're also going to, along with it, get mercury, some other heavy metals, PCBs, and cholesterol. Okay? There's much better omega-3 sources. In fact, individuals that are on a plant-based diet on a regular basis eat more omega-3s than individuals who are on an animal-based diet, because omega-3s have their source in plants. The animals, the fish and that kind of stuff, they get it from the phytoplankton and that kind of stuff that they eat, and then it accumulates down the line. But so do the toxins.
So that's not true when they say that you eat fish.
Well, the fish do have a higher concentration of omega-3, and so if you eat the fish oil, right, you'll get a high concentration of it as well. If you eat flax oil, you get a high concentration of it as well. Flax and chia seed are pretty high sources of omega-3 fatty acids. Walnuts, some of your other nuts as well, are good sources from that standpoint. No, you don't have to eat fish. All right, so triglycerides should be below 150. HDL, that's your good cholesterol, below 100. Yeah, triglycerides below 100. HDL, your good cholesterol, that is a carrier molecule for cholesterol, takes it from the body to the liver to be produced, to be broken down and used and whatever. Anyways, that one should be as high as you can get it. Right. However high you can get it, that's fine. What are some things that cause it to be elevated? Well, exercise helps to bring up the HDL numbers. Nuts tend to help to bring the HDL levels up. But you got to watch out, because if you eat too much nuts, it can cause your total cholesterol and your bad cholesterol to go up too. Oils in the diet, fried foods, other types of things like that will also mess up the cholesterol profile.
How does the nut,
How does eating the nuts affect the cholesterol? It depends on the individual's genetic background. Some individuals are already predisposed to producing too much cholesterol, and so if you provide the fat substrate in the nuts, then their cholesterol levels will go up. The most common reasons that we see individuals who are on a plant-based diet who have high cholesterol levels because they're eating too many nuts and they're using oils in their diet. The two most common reasons for having high cholesterol levels in individuals on a vegan or a plant-based diet. So the oils the liver uses them as an easy substrate to then convert into cholesterol and then produce the extra cholesterol.
That's too low.
Yeah, well, if you have a low cholesterol level, it's below 150, and your HDL is low as well, that's okay. It's okay because you can't have too much of it, because your total numbers are low. So if your total number is below 150 and your HDL is low, that's okay. Let's see, it does the LDL to HDL ratio. I usually don't look at that, but the lower it is, the better it is. Yeah, so the lower that number is, the better it can be for you. You don't want to get somewhere in the 3 range or above. That's the LDL to HDL ratio, the next number. Now LDL below that is your low density lipoprotein, your bad cholesterol. Right? For the general population, you want that to be less than 100. And if you have known heart disease or you are diabetic, you want that to be less than 80. So if you've got diabetes and you have known heart disease, you've had a heart attack, you know you've got coronary artery disease, you've had stents that have been placed and that kind of stuff, you want that at least to be below 80. Below that is VLDL cholesterol, very low density lipoprotein. It's considered to be a bad one. It's just the carrier molecule for triglycerides. So if your triglycerides are high, it's going to be high. If your triglycerides come low, it'll be low. So it just mirrors what's going on with the triglycerides.
Is there a range for vegetarian base?
Well, yeah, it should be, typically with plant-based individuals, you're looking at the 5 to 25 range or so, to 30. But I don't usually run the numbers as far as the VLDL is concerned. I'm more concerned about the triglyceride numbers. And the VLDL just mirrors it. It goes right along with it because it carries the triglycerides. Cholesterol to HDL ratio. The lower you can get that, the better it is for you. All right. If you are somewhere around 4, 3.5 to 4, you are considered average risk for heart disease, and the average individual dies from heart disease. So you don't want to be average, you want to be low risk. So if that number gets low, that's actually a really good thing. The non-HDL cholesterol, that's just your total cholesterol minus the HDL, that gives everything left. If the rest of the numbers are where they should be, that one will be as well. Again, I don't put a lot of weight on that. The GGT below that, that's another one of your liver function tests. If the rest of the liver function tests are normal and this one is elevated, so the rest of your liver function tests are normal and the GGT is elevated, then it's either because of fatty infiltration of the liver, so you've got too much fat and some of that fat's getting put in the liver, or it's because of alcohol and its impact on the liver, or it's because of diabetes and its impact on the liver. Rarely could it be related to a cancer that involves the liver. Sometimes the GGT will go up first before the other liver function tests will go up in individuals that have cancer of the liver. And but usually you'll see it and the other liver function tests elevated if there's a cancer in the liver. Iron below that, you want it to be in the 50 to around 150, 160 range. Iron is in the last lecture, Valentino was talking about oxygen-free radicals. Right? The reason why you want antioxidants, because you've got these free radicals that are going on. Iron is a very potent oxygen-free radical. So it can cause oxidative damage in the body if the levels are too high. Now, if you have low iron levels, you need iron, right? So you need to take iron in order to get the levels up to the normal range. But if you're in the high normal or high range from the iron, then you're more at risk for cancer and you're more at risk for heart disease because of its pro-oxidant effect. So again, that one's around 50 to around 150 or 160 is the range that you want it to be in. Homocysteine below that, that is a non-protein amino acid, meaning it is an amino acid, but it's not one that your body uses to make proteins with. And it is associated with Alzheimer's disease or dementia and with cardiovascular disease if its numbers are elevated. And from a dementia standpoint, one research paper that I was looking at, individuals with 14.6 have twice the risk of somebody who's around 10. And we like to see individuals with numbers below 10. So ideally, we want to see those numbers below 10. What is it that you can do in order to decrease your numbers if it's higher than you want it to be? Take B complex. There's 3 different B vitamins that are involved in the metabolism of homocysteine. And so if your homocysteine levels are higher than you want them to be, then you need to take B complex on a regular basis so you get those different B vitamins. And then that can start driving the homocysteine levels down. And that's a long-term type of thing. C-reactive protein, that's another marker, or CRP quantitative. That's another marker of inflammation. Sometimes your sedimentation rate will be elevated and CRP looks fine. Other times the sedimentation rate is fine, the CRP is elevated. Sometimes both of them are up, sometimes both of them are normal. But it's just another marker of inflammation. Again, it can be infections, it can be trauma, it can be autoimmune problems. Less frequently cancer, although it can in later stages. Elevate the C-reactive protein. And so again, that's just another marker for inflammation. And if your numbers, again, I like to see them kind of in the lower half of normal. That's the more comfortable range to be in. Yes. All right, so if you have a marker for inflammation, what do you do next, or where do you look next? The next thing is, if we don't have a clue what's going on, is to go back to your history and your symptoms and that kind of stuff. Where do you have pain? Where do you have aches? Do you have any complaints or anything like that? Are you weak? Are you fatigued? You know, investigating more to try to get an idea of where something's at. Sometimes we just sit back and scratch our heads and go, I don't have a clue. Because the blood work's not pointing anything out, your symptoms aren't pointing anything out. In those cases, usually we have the benefit of having people here in our sessions, lifestyle session for 2.5 weeks. And so we can then do the repeat blood work, and if the inflammation has resolved itself or if it's significantly improved, at least we can look at it and say, well, what we're doing now is working, right? Whatever inflammation, wherever it is, it's going down. And so, good, even though we might not know what might be going on. It's kind of like picking a dot on the globe and it's shining bright, but you don't have a map to go along with it to tell you where on the globe you're pointing at. And sometimes it's very difficult to try to pinpoint anything, from that standpoint. Hemoglobin A1C below that. That is your general marker for diabetes or pre-diabetes. This tells you how high or low your blood sugars have been on average for the last 3 months. And so your sugars might be really good right now because you control them, but if your hemoglobin A1C is elevated, then you know you haven't been good. Your A1C should be below 5.7. So that A1C should be below 5.7. And the lower it goes, usually the better. 5.7 to 6.4 is pre-diabetes. If you're in that range, then you're officially pre-diabetic. And if you're 6.5 and above, then that's diabetes. And in general, the lower you go, the better it is for you. And again, this gives us an idea of how well you're doing over a prolonged period of time. Now, there are some things that will mess that up. Sometimes hemoglobin A1C levels will be elevated in individuals who have a more severe iron deficiency anemia. If you have certain issues with the blood, like sickle cell anemia, if you have a genetic difference where you don't make as much of the hemoglobin A1C molecule, but you have another one that's substituted in there. These are things that can mess up the hemoglobin A1C, but it doesn't happen very often. Usually it's pretty right on as far as its numbers. Now insulin below that, insulin is exactly that. It's the insulin that your pancreas is producing, unless when you took the test you are on insulin. Because it'll pick up any long-term or short-term insulins that you're taking if you're diabetic. And so it doesn't tell us a lot if you're on or taking insulin. But if you're not taking insulin, it gives us an idea of how much insulin your pancreas is producing. If your blood sugar level is good, and your insulin levels are pretty low, 2, 3, 4, somewhere in that range or so, then you don't really have insulin resistance and you're doing pretty well. If your blood sugars are kind of low, but your insulin levels are high, and you're running 8, 10, 15 or something like that, then that means that you've got a lot of insulin resistance that's going on. Your pancreas is still able to keep up by producing the extra insulin in order to get your blood sugar levels down. But you're on the pathway to diabetes. If you get to the point where the pancreas starts petering out, then your insulin levels start coming back down and your blood sugar levels start going up. And then you can get to the point where your blood sugar levels are like really bad and your insulin levels are really low. That means that your pancreas is it's dying. The beta islet cells. You're losing a lot of your beta islet cells and the pancreas isn't able to produce the insulin that it's supposed to in order to get your sugar levels down. Yes?
Just clarification, you said low iron reflects on the hemoglobin count?
The hemoglobin A1C, yes. Low iron is the most common reason for your hemoglobin level to be low. Hemoglobin. What we just talked about was the hemoglobin A1C. Right. So you can have a high hemoglobin A1C because of a bad iron deficiency anemia. That can happen. But your hemoglobin will be low because of an iron deficiency anemia. That was on the first page. All right, almost to the end. Thyroid, TSH. TSH is thyroid stimulating hormone. This is released from the hypothalamus in the brain, the pituitary gland, hypothalamus and the pituitary, and that helps to stimulate the thyroid gland to release its hormone. The TSH, if the number is higher, that means that the thyroid function is lower. If that number is lower, that means that the thyroid function is higher. Okay. You have high number, low function. Low number, high function. Some individuals will use 1 as a cutoff level and say that anything that's below 1, the lower it is, even within the range, the higher the thyroid function is. And the higher it is, even within the range, the lower the function is. Right? So it tends to correlate with the function of the thyroid. There is some variation to that. We will see some pretty wild fluctuations in individuals from time to time, where they came in with a 1 and they ended up with a 4 when they cut through and 2 weeks later. Or sometimes they've got a number around 5 and then the next time they're down at 2. So there are some pretty wild variations that happen from time to time. And so if it's abnormal, I want to test it, but I want to retest it. Right? Because it may just be something that's fluctuating a little bit, or sometimes a large bit. Some people will use 1 as a cutoff, so anything that's below 1 is considered hyperthyroid. And below 1. Right. And again, it's something that you would want to test several times, at least twice, to make sure that it really is below 1. It's not something that's just fluctuating. And then others will use, for an upper cutoff, we'll use around 5.5 or so for an upper cutoff. And if it's above that, then you're hypo or under functioning thyroid. Now, if I see the numbers that are at the extremes or that are low or high, then I usually want to follow that up with another test, a free T3, free T4. Some people use a reverse actual thyroid hormones to check and see if the actual thyroid hormones are elevated or depressed. That would be a follow-up test there.
So, in this case, this person is kind of very volatile.
Mhm.
Hypothyroid.
Okay, so a low number would be likely hyperthyroid. So if you're running somewhere around, 0.5 or something like that, or 0.6 or lower, yeah, then it would be an over-functioning. Yeah, the lower the number, the higher the function. The higher the number, the lower the function. Last three, your vitamins, B12. All right, you really want that to be in probably the mid 300s to 400 and above. If you're running low 300s or 200s, you can, even in those ranges, you can have symptoms of B vitamin deficiency. And if you're in that range, I would recommend go ahead and supplementing with the B12. Now the B12, like on this case up on the screen, the B12 can be high. That usually does not cause problems, and usually individuals are high when they're on some form of supplementation or they're using B12 fortified foods. They can be high like that, and that usually doesn't cause a problem, and so I don't have people necessarily stop when they're in that range. B12 is the great mimicker, the great neurologic mimicker, and so you can have all sorts of neurologic, usually nerve or brain-based problems associated with B12 deficiency. So you can have nerve problems, neuropathies, pins and needles sensation. You can have issues with like dizziness and imbalance. You can have issues of mental problems and a lack of clarity of thinking. Individuals tend to have some fatigue associated with it as well. There's all sorts of neurologic stuff that can happen. You can even have a paralysis. Somebody looks like they have a stroke and they're paralyzed on part of the body. And lo and behold, it's a vitamin B12 deficiency. You replace the B12 and the paralysis goes away. Yeah, I like to see it in the, typically the 400 and above range for individuals. Folate, it's another B vitamin, and it's involved in a number of different processes. It's associated with too large red blood cells, a number of other things, homocysteine and that kind of stuff. And so that really should be within the reference range. You don't want it to be low. Okay. High is okay. High is okay. But you don't want that to be low. What do you do about it? You supplement with folate. And eat high folate containing foods like beans, green leafy vegetables, and that kind of stuff. And then finally, vitamin D, that's your vitamin sunshine. This is very important. Vitamin D deficiency is associated with increased risk of cancer, increased risk of heart disease, increased risk of diabetes, increased risk of obesity, and there's a number of other things. Vitamin D is actually not a vitamin, it's a hormone. This is obtained by sunlight exposure. You really want to have it in the normal range, and some research indicates that the 30 to 45 range is probably best. 30 to 45 range tends to be best for individuals. You get higher than that, you may have some complications, not necessarily, but if you're supplementing and you're going higher than that, then you can. If you're doing sun exposure and you get higher than that, you're usually just fine. You can't overdose with vitamin D with sun exposure. But you can with supplementation. And so if you're low, make friends with the sunshine. If you live in higher latitudes, It depends on the individual. Typical amounts for supplementation are around 2,000 international units per day. But if you are, it depends on how much fat content you have, because it gets stored in the fat. And so if you have lots of fat, then it's going to, the vitamin D, because it's a fat soluble vitamin. So if you have plenty of stores of fat, you'll have to use higher amounts of vitamin D in order to get your levels up to the normal range. If you are skinny and you don't have very much fat, then it doesn't take very much to get your vitamin D levels up. And so it depends on the individual. The individuals that I've seen that have overdosed on vitamin D tend to be short, skinny females. That's every case that I've seen so far that have critically high levels of vitamin D, short, skinny females, because they don't have very much fat to store it in, and so the blood levels that accumulate and get too high.
So what could they overdosing of
You can have all sorts of different things associated with vitamin D toxicity. Metabolic problems, all right? So you can have problems with metabolism. You can have problems with digestion. You can have problems with neurologic complaints and symptoms and that kind of stuff. Sometimes it's really vague, and so it's difficult to figure out what's going on until you actually do the blood work and you find that, oh, they've got a vitamin D of 150. And then what do? Stop the vitamin D, and the levels will come down. Yes.
With menopause issues, hormones are fluctuating, and does that affect your D numbers as well? Could that affect vitamin D numbers?
Do menopausal issues with fluctuation of hormones affect the vitamin D levels? Not much. Not much. Question?
Yes, I just want to verify, you said between 35 and 40 was an excellent range for your vitamin D.
Between 30 and 45.
30? And that was if you were not supplementing, but getting it from the sunshine?
That would be with supplementation as well. For sunshine, that's the kind of the ideal range. If your numbers were higher than that and you were getting it from sun exposure, it's usually not a problem. But if you're getting it from a supplemental form and it's higher than that, then sometimes you can have problems associated with it as well.